I'm Dr. Anita Fleenor Ford, one of the infectious disease physicians at Heartland Clinic. And I've actually been in Paducah for 19 years in August, this past August. And started actually with Heartland Clinic when there were about 40 patients pre-enrolled. They were actually in a housing program for housing opportunities for people with AIDS or HOPWA. Pre-enrolled in that program and then pre-enrolled in the clinic, and there was a planning grant for the clinic, which was already taken care of by the time I got here, and the clinic was ready to be up and running. I believe just over 400 now, and we still get new clients on a regular basis. People move in and out of the community, or in and out of different situations, come back to the clinic after they've been gone for a while, and then brand new diagnoses still, unfortunately. Although it's pretty common in a lot of areas and a lot of primary providers take care of HIV patients, in some areas it's not really the case in this area. I think it's very important for people who are specialized and just know HIV and AIDS. It doesn't always have to be infectious diseases, but it has to be their area of interest. And in this area, it's necessary. Most of the primary care providers, they have so many other areas that they're paying attention to. It's not an area of focus for them. And also, everybody that's employed at this clinic and the support services, everybody that's the nursing staff, the front office staff, the support staff, they're here for a reason. It's their choice to be here and their choice to stay here. So the patients that walk in know that, and they know that they have their own area of expertise, and all the support staff. And then the support services with housing, mental health, and social services, basically. It's just a unique set of circumstances that just doesn't function without it. Well, we've definitely morphed from a chronic illness where we're keeping people alive just a little bit longer versus managing the illness as a chronic condition that they're going to have a normal to near normal life expectancy. And the medications have changed remarkably. I try to tell some of our newer patients that my first patient had 44 pills a day. I remember that well, counting them up. And part of that was because he was so sick to begin with, and we had other medicines that he had to take. And now, literally, they could be diagnosed and take one pill once a day, which is just unbelievable. So that's much more manageable. Side effects are so much more manageable. And then more information about the opportunistic type infections or malignancies to treat people. You know, it's a treatable, manageable condition. I think it is so important to know, because then you're at least armed with that information, and you can find out not just your HIV status, but where things are with the progress of that infection. And there's a couple of lab parameters that we check to see, because someone can be otherwise healthy on the outside, feeling fine, and then ongoing progression and damage from the virus can occur. They can transmit the virus, which is another problem, unknowingly transmit it, and then the infection continues to spread, which is what we've seen. The main thing is to know your status and stay healthy and get on medications. And then it's truly manageable. HIV really can permeate every part of the body, and we still, even after almost 30 years, are learning some of the effects over time. But we know it can involve the brain, the spinal column, the fluid, the blood, and there's sanctuary sites where the virus may hang out, you know, the spleen, the lymph nodes, that type of thing. What we know over time is that there's some low-level inflammation that can occur from the virus alone. There's probably premature cancers if it's not treated. Premature heart disease can affect the bones, perhaps thinning of the bones sooner, fracture sooner. So the reason for treatment earlier is you control that early, then you can postpone all those things that happen with normal aging, and then basically put HIV patients on the same playing field as non-HIV patients.